Hi, this is Vaughn at Spirit of Health. This is a video about common medical procedures to potentially just say no to after birth. Remember that old 80s slogan, just say no to drugs, and you got the war on drugs? Well, unfortunately, that drug mentality isn't just the illegal narcotics that people are doing, but it involves a lot of the things happening in the medical field that are actually dangerous to the human body. And we feel like a lot of the things that happen after birth, not saying that they didn't have good intentions from the beginning, and I'll make that disclaimer. There probably were good intentions and good reasons why people think these drugs were necessary. But our heart is to trust God, and we really value and believe in home birth. And we really think that that's a better, safer, more normal procedure than what's happening at hospitals. So we're going to go through a few of the common procedures that happen immediately after your baby's born. And then you want to decide and you want to pray if these are things that you want to do to your child. The first thing is cord clamping. It's very common in the medical field upon birth for them to immediately they cut that cord. Baby comes out, they cut the cord. Now, there's a lot of blood that continues to pulsate to the baby, and it takes quite a few minutes for all that blood to transfer to the baby, and that can leave the baby void of valuable nutrients and things that come from the mom immediately after birth. So you want to wait on that cord clamping. So that's something, again, if you're in a hospital setting, you're going to have to fight for that, because that's something that they do right away. At our home birth experiences, it's always been an amazing blessing to have the baby born, and then we get to take our time, and when we're ready, I actually had the honor of cutting the cord myself after all that blood has deposited properly into the baby. A second thing that happens commonly in hospital settings is those antibiotic eye drops. So you want to research this, because there's a common antibiotic known as erythromycin that's super common that people take for various number of reasons. But if you look at the side effects, you would be shocked to see the possibility of kidney damage and liver damage, and how they say there's warnings and precautions against women who are pregnant and breastfeeding, yet they're going to put this in the eye of a child upon birth. So I think that's dangerous. It's the reason that they do it is because women have issues with venereal diseases, oftentimes gonorrhea and syphilis. But you can check for these things. You can test to see if you have any of these issues. The mom can get these things tested. And if you don't have any of these issues, and for many women, this is a non-issue. You haven't had any of these issues throughout your life. So you don't need these antibiotic eye drops. Again, it's an extra safety precaution. And as I said earlier, it's not that there were ill intents with these things. I'm sure these things have been helpful to children who are born with women who had different types of diseases. But for most people, it's not necessary. And for them to make it a normal procedure for every single baby that's born is unnecessary. And again, it's dangerous and unsafe, because there are a lot of side effects to taking synthetic drugs, especially this antibiotic erythromycin. So you might want to research that. The third thing that's common is jaundice, babies being born jaundice, which is a liver issue. Babies are born with compromised liver. They're a product of mom's health when they're born, oftentimes, mom and dad's health, but often so more the mom. And it's back in the old days, we'll call it, they used to wheel the babies out into the sunshine, because sunshine heals the body. God's creations heal the body, and that would make the jaundice go away. And it became common in hospitals to start using lights or blue lights or sun lamps. And now that's what they do. And so you can still do that, and that's going to be common, a medical procedure. But I would encourage you, we would encourage you to get that baby out into the sunshine, out into the fresh air. It's much more valuable, much more healing to the body than just being under a man-made lamp indoors. The fourth thing I'm going to mention is the screenings that they do for genetic disorders. It's the heel prick test. And the question is, why do we need to do this? They are going to check for these genetic disorders. They're going to put you in some database. Maybe they're gathering statistics. Maybe they're going to want to, if they find something, they're going to want to do some kind of treatment for your child that you may or may not want to do or be interested in. And so again, we just have to question why these things are even necessary. If it's traumatic for the baby, I mean, you're pricking the heel and drawing blood out of a newborn baby. That can be a pretty traumatic process for a newborn. The last thing I'm going to mention is some shots that are immediately given to the baby upon birth. One is the Hep B vaccine, and the other one is the vitamin K shot. The Hep B vaccine I've never understood. It makes no sense. There's no logic to why they give this to newborn babies. Women can be checked and screened for hepatitis B. The vast majority, don't know the exact percentage, but 99% of women are not going to have hepatitis B. So why would you give it to a baby? Why would you give this vaccine or this shot to a baby? It's a sexually transmitted disease. There's no way this baby's going to have this issue, nor is this baby just going to pick this up anywhere. They give this shot upon birth. They give it at 2 months, and they give it at 4 months. And all these vaccines, you've heard our classes before, they're all toxic to the human body. They're all dangerous, and they cause major sickness and disease. They lower the vitality and the life force of anybody who gets an injection or a shot. And again, it's just not necessary. So research that Hep B vaccine, because all of these things you can opt out of. All of these things you can fight for your rights, even if you're in a hospital setting, not to get these things. You might have to sign waivers. You might have to have other family members there to protect that newborn upon birth, but you can choose out of these different scenarios, these different injections and things that they're doing. The vitamin K shot is an interesting one we want to spend a few minutes on because it's important. It's the clotting factor. So the reason they give the vitamin K shot at all is the potential of the baby bleeding and not being able to clot. So it takes a while for the baby's blood to be able to clot. At least 8 days. We know that biblically because we don't do circumcision until the 8th day. But it takes at least that long, if not longer, for the blood to start clotting appropriately. And if the baby would get in an accident on the way home, the baby could possibly bleed, not be able to stop the bleeding, and that could be life-threatening. So again, we understand why maybe some of these things developed. Here's the danger, here's the concern. Vitamin K, the shot is synthetic. It's 20,000 times more than would ever be normal to put into the human body. And again, this is to an infant, an innocent newborn infant child. In this shot is propylene glycol, which is an ingredient in antifreeze. In it is coal tar-based ingredients. There's alcohol type of ingredients. These things are very dangerous to the liver and to the kidneys of anybody, let alone a little baby right out of the womb. So we have to ask, is the risk of putting all those things in a baby necessary? Now I'm going to read this because this is on the warning label of the vitamin K shot that they give to every single baby in a hospital upon birth. It says this: severe reactions, including death, have occurred during and immediately after intravenous injections of phytonadione. Sorry, it's a hard word to say. It's a synthetic vitamin K. The reactions also include anaphylaxis shock, cardiac and respiratory arrest. So are you trusting your doctor and just doing the shot and having no idea of potential side effects, of the risk, of the harm? Now, what I always try to help people understand to make logical sense of this is if that label's on the warning, if that warning's on the label, this is happening to real, innocent human beings. Shock, death, cardiac arrest are happening to newborn children, and it's still legal for them to give it to children. So again, why would we take this risk of doing these things to our unborn if it's not necessary? If you're in a hospital setting, they might not let you leave the hospital unless you get a vitamin K shot. So you might want to look at alternatives. So there's a product by Biotics Research. It's called BioK-Emulsion. And it's actually that same synthetic form of the vitamin K, the phytonadione, but it's grown through a bacterial culture, which makes it a natural form because it's grown through a living organism. So it turns it into a bioavailable active form. On top of that, it's it doesn't come with all the side effects of the shot. The reason it's causing death and cardiac arrest and all these things in infants is because of these coal tar-based ingredients, these alcohol byproducts, the propylene glycol that's an antifreeze. Things are never meant to go into the human body. So you're much better off taking a natural form of vitamin K, or this BioK emulsion. Biotics research is super common and popular among midwives in a lot of places because you're not going to have all those potentials for all those negative side effects. This is also why women are encouraged to take alfalfa during the entire third trimester, is to increase that vitamin K and that clotting factor. You also want to look at the vaccine schedule after birth. At 2 months and at 4 months, both at 2 months and at 4 months, they're going to do another Hep B vaccine. You're going to have rotavirus. You're going to have diphtheria and tetanus and pertussis and influenza and polio. And so most of you probably know our stance on vaccines. I believe they're unnecessary. They're contrary to God's purpose and design. God didn't build our immune system to have needles and toxic ingredients injected into them. I understand the concept of vaccines, but there are other safer ways to do it. And one of the best ways to do it is through homeopathics. Another great way to do it is just providing a safe environment for your baby and having him naturally encounter things of the world through the normal process of the immune system and the body that God designed. So I think of this vitamin K shot, for example, and it just makes sense to us that this is why it makes sense to have a home birth. Because why would we have to invent chemical injections and synthetic ingredients to inject into our newborns if the process of giving birth, this God-given process of life, is supposed to just happen at home, in the peace of our own home? We're not going anywhere. We're not driving anywhere. There's no risk of the baby getting injured. It's normal and natural, and it makes sense to just have children at home. It is abnormal to have birth in a hospital. We have made it normal. We've made it a medical procedure. And so we just really encourage people to just search their heart for how they want to do birth. And whether you choose a hospital or a home birth, look at these things that they're doing immediately upon birth to these innocent newborn children and decide for you, is it worth the potential risk of doing these man-made interventions? And again, you can choose to opt out of them. Do your research, do your homework, because again, our heart, our desire, God's heart, God's desire is to bring forth healthy, new children, give them the best chance and opportunity to have an amazing, healthy life right out of the womb. And I really believe a lot of the things we're doing in our medical community are working against that process. And again, not that that was their original intention, but that's what it's become. It works against God's natural purpose and design. So we bless you. We bless your newborn baby. We pray that you have just an amazing journey with bringing new life into this world, and that it's peaceful and relaxing, and you give your baby the best opportunity at a new life. God bless.